Hello, I'm Richard Coates. I'm a musculoskeletal physiotherapist working in private practice and a part-time PhD student at Cardiff University. This is a PowerPoint presentation which is part of a programme of research investigating the use of wearable inertial measurement units, or IMUs, in shoulder rehabilitation and return to sport decision making. This presentation aims to inform you as a clinician on what IMUs are, how they work, and what data they provide. It is hoped this will facilitate a later discussion to explore your opinions on how this technology may be used in clinical practice, what information you would value, and how you would like this data to be presented. Shoulder injury affects professional and amateur athletes alike. Epidemiological studies have shown a high incidence of shoulder injury in a diverse range of sports, such as volleyball, handball, rugby, tennis, swimming, and cricket and baseball. Following shoulder injury, there's a high rate of recurrence, making return to sport problematic. Historically, the passage of time has been used as the sole criterion in deciding whether an athlete should return to sport or not. However, when a battery of tests evaluating shoulder function are used to help inform that decision, a more successful return to sport has been shown. So, biomechanical assessment helps quantify kinematic and kinetic forces acting upon the body. This has been used in sporting environments to help improve performance, prevent injury, and facilitate effective rehabilitation programs by providing objective data to enable progress monitoring, inform goal setting, and clinical decisions. Much of upper limb biomechanical assessment has been carried out using high-speed camera-based motion capture systems that detect reflective markers placed at specific anatomical locations. Unfortunately, these systems are quite costly, time-consuming, and require a laboratory environment, which means athletes cannot be evaluated in environments which are relevant to their sport. Inertial measurement units help to solve some of these problems. Inertial measurement units combine a gyroscope measuring angular velocity, an accelerometer measuring linear acceleration, and a magnetometer which gives the IMU orientation. These elements combine to provide kinematic data. In contrast to camera-based systems, IMUs are relatively inexpensive and do not rely on a laboratory location, making them portable. This means they can collect biomechanical data in clinical and sporting environments. As you can see from the picture on the left, they are placed at standardized locations on the body, but do not need to be placed at specific anatomical locations as with camera-based systems. This video shows a sped-up version of the application and calibration process. In this protocol, the IMUs are attached to the head using a headband, to the hands using gloves, and to the upper and lower limbs using straps. All these are provided by the manufacturer. To reduce the effects of movement artifact, the IMUs have been attached to the sternum, scapula, and pelvis using sticky tape. As you can see from the clock on the right hand side, the application process takes roughly 12 minutes. The MVN software that collects this data is displayed during data collection on playback using a dashboard. This dashboard displays the individual as an avatar, and alongside this presents a graphical representation of the movement. In this case, joint angle data has been used, and we've selected the right shoulder, thoracic spine, and right hip. But you can also select speed, position and acceleration data, and also other joints and segments of the body. Here is an example of how that data is displayed. On the left hand side, you can see George is conducting a power clean with the IMUs attached. On the right hand side, we have the avatar at the top displaying George's movement, and alongside that the waveform data is shown in real time, displayed in this case displaying joint angle data. If we move on to throw-in, on the right hand side you can see Tom is throwing to a target, once again with the IMUs in situ. On the left hand side, once again you can see the IMU, the avatar at the top displaying Tom, and then the waveform data showing joint angle data at the upper limb, torso and pelvis alongside that. The data can also be displayed and exported as an Excel document. This produced quite a large amount of data, as each data point is sampled at 60 times a second or 60 Hertz. I've included an example of an Excel document for one of the movements in your packs. So, our research. We're conducting a mixed methods evaluation of the use of wearable technology in return to sport decision making. To date, much of the qualitative research conducted investigating the use of IMUs in rehabilitation has focused on lower limb disorders, osteoarthritis or neurological conditions. There's been little research investigating the use of IMUs in upper limb conditions or in return to sport decision making. So further research is needed to develop processes that enable the use of IMUs in clinical practice. The ultimate aim of this research is to provide a suite of tests that provides objective data that facilitates efficient and effective rehabilitation and return to sport following shoulder injury. Previous studies that have investigated the use of technology in healthcare have promoted a user-centered design when developing these technological solutions. This promotes a close collaboration between engineers, researchers, and clinical end users to ensure that any new systems developed have clinical relevance and are ultimately accepted. This study will therefore act as a guide in developing this suite of tests to evaluate and track patient recovery following shoulder injury to facilitate these effective rehabilitation techniques. It aims to do this by exploring the opinions of athletes involved in overhead sports and clinicians who are involved in the rehabilitation of athletes back to sport following shoulder injury. So what do we want from you? Well, we want your opinions. We want you to take some time to consider the clinical applications of this technology and ask yourself some key questions. These questions are not a test, they're intended to stimulate thought. It is hoped that this will help you to come to our interview with your opinions ready to share. Thank you for listening.